Good morning, professors and everyone. My name is Xiangjun Chen, and my advisor is Dr. Chen from China Medical University. Today, we are going to talk about therapeutic effects of exercise combined low-level laser therapy on patients with peripheral artery disease plus diabetic foot ulcer, and this is a pilot study on feasibility and therapeutic effects. Diabetic foot ulcer is one of the most serious complications of diabetes. It will lead to some level of lower extremity amputation, and the risk of death is higher when patients have foot ulcer or become amputated. Peripheral artery disease, brief as PAD, is an independent predictor of foot ulcer infection and amputation. The severity of PAD ranges from asymptomatic to critical limb ischemia. Patients with PAD experience a decline in functional capacity and reduced quality of life. And according to prompters, about 50% of the patients with diabetic foot ulcer also have concomitant peripheral artery disease because diabetes is associated with osteogenesis. And the microcirculatory dysfunction is characteristic of people with diabetes. It will result in reduced capillary blood flow, reduced hyperemic response, and vasodilation, especially in patients with PAD and diabetes. PAD also impairs downstream cutaneous microvascular vasodilation function. Combination of PAD and diabetes resulted in more difficult wound healing and poorer outcome. The relative contribution of atherosclerosis and the microvascular dysfunction is very difficult to determine. So even after successful revascularization, cutaneous microcirculation cannot be recovered completely, and about 40% of the wounds are still not healed in 1 year follow-up. So the patient with PAD and diabetes, we call that diabetic PAD, represent a spatial subgroup that tend to have different clinical presentation, natural history, and outcomes. The low-level laser therapy is beneficial as an adjunct to conventional therapy in accelerating the healing of diabetic foot ulcer. It not only decreases inflammation, increases granulation, but also increases angiogenesis and improves skin microcirculation. But in the previous study, PAD or ischemia was excluded. And so there is no study investigates the effects of low-level laser for patients with diabetic PAD. The physical function of diabetic PAD patients also lower, have lower physical activity level and reduced physical function. And no matter patients with diabetes or PAD, there was a faster decline of muscular mass and the muscular strength. According to American Diabetes Association, the weight-bearing activity should be avoided with unhealed ulcer. And resistance exercise is an effective strategy to counteract the deterioration of muscular performance and working ability in patients with diabetes or PAD. The purpose of our study is to examine the therapeutic effects of exercise combined low-level laser therapy on patients with PAD plus diabetic foot ulcer could improve microcirculation wound healing and improve maintain working ability and delay muscle atrophy. Here is our study design. After assess the eligibility of the participants, we randomize the participant into control group and the low-level laser group. We use stratified randomization based on wound size and embolization status. The treating frequency is 2 to 5 times for each week and totally for 4 weeks. The control group received conventional treatment and exercise intervention. The low-level laser group received conventional treatment, low-level laser, and exercise intervention. The pre, mid, post intervention evaluation is at baseline T0, after week 2 T1, and after week 4 T2. The inclusion criteria is that the patient had to be diagnosed as type 2 diabetes and PAD. The ulcer was located on the lower extremity and present for a minimum of 2 weeks. The exclusion criteria includes that the patient have acute cellulitis, osteomyelitis, presence of hepatic, hematologic immune disease, presence of malignant disease not remission for more than 5 years, use corticosteroid immunosuppressive agent, and pregnancy. The irradiation of low-level laser is for 10 minutes which equals 4.5 joules per centimeter square. Our exercise intervention consisted of resistance exercise and functional activity training. The target muscle is hip extensor, hip abductor, knee extensor, bicep tricep muscle, and the functional activity training is individualized. Outcome measure. We use image jet software to measure the wound size. We classified the wound by organ classification. And the microcirculation is measured by the skin temperature by thermography of the dorsal and the plantar side of the foot. The pain intensity of the wound was measured by the VAS. The sensor was assessed by the same Western monofilament if the patient was unable to perceive more than 4 sites of the 10 sites was regarded as an abnormal sensation. The walking ability was assessed by 6-minute walk test, and the quality of life was assessed by SF-36 scoring system. The protocol had been approved by the ethics committees of Fengyue Hospital. We used the Mann-Whitney test to compare between group, and the Freeman test and Wilcoxon test was used to compare intra-group differences. Category data were analyzed by a chi-square test. Here is our console flow chart. After assessed 25 participants for the eligibility, 13 were excluded. Mostly was because they refused to attend a protocol. And finally, we got 5 in each group was included in the primary analysis. Here is our baseline data. There was no significant difference between the demographic data. And here's the outcome measure comparison within groups. We found that the wound size and percentage of wound reduction was improved significantly in the low-level lesser group, but not in the control group. And the 6-minute walk distance is improved significantly in the low-level lesser group, although the distance was improved in the control group, but not significant. Here is the result of SF-36. Only bodily pain improved in the low-level lesser group, but not in the control group. And here is the comparison between groups. We found none of the outcome measure improved significantly. And here is the comparison of the SF-36, either no significant differences. And here is the comparison of the sensory test. Only the sensory of an affected leg was changed, but although not significant, but the normal rate is improved from 33% to 60% in the control group, and improved from 66% to 100% in the low-level lesser group. And we also calculated the correlation of the percentage of wound reduction and the skin temperature. We found there was a strong positive and significant correlation between the mean value of T1, T2 skin temperature of the plantar side of the foot with the percentage of wound reduction, which is that the higher temperature was correlated with better wound healing. Discussion. This is the first study of therapeutic effects of exercise combined with low-level laser on patients with PAD and diabetic foot ulcers. The low-level laser can increase angiogenesis by modulating the cytokines, but also it can improve microcirculation by increased nitric oxide level. According to previous study, the low-level laser can work in ischemia situation. The diabetic mice with high limb ischemia, which is similar in our diabetic PAD, treated with this low-level laser, had doubled the capillary density and blood perfusion rate. And in the occlusion of blood vessel, low-level laser can accelerate the collateral circulation and enhance macrocirculation. Only few studies have focused on the effect of exercise on patients with diabetic PAD, and after 3 months supervised exercise training, diabetic PAD improved max work time in exercise testing, but the improvement of claudication onset time was attenuated. And according to previous study, we found that diabetic PAD have lower physical activity level and reduced physical function. What will happen if they experience a period of bedridden? All our participants experience a period of bedridden, mostly from the instruction of the physician due to the bypass surgery. Exercise training at the right time was also the reason that the participants improved their walking ability. Without less exercise training, these patients might decline faster in muscle strength and physical function and leading to irreversible physical disability. Although the evidence of exercise can heal diabetic foot ulcers, healing was not enough, especially for patients with concomitant PAD. But according to previous study, we found that the endothelial function was lower in patients with PAD and diabetic PAD, and exercise can improve the endothelial function in PAD patients. And according to Lima, combined resistance exercise and walking exercise can increase plasma nitrite and decrease leg vascular resistance, although further studies should be investigated to confirm the facts. Here's the conclusion. Exercise combined with low-level lesson might enhance wound healing and reduce pain in patients with PAD and diabetic foot ulcer. Also, the exercise was able to maintain and improve the walking ability of patients with diabetic PAD. And here is our reference. And thanks for your listening.